Hi, my name's Ned Newitt and I'm going to talk about how Leicester was hit by the flu epidemic of 1918 and 1919. Of course, it was known as the Spanish flu, but like COVID-19, it was a global phenomenon and there was nothing Spanish about it. These figures show a comparison between deaths from war and deaths from flu, and you can see that in Leicester 1,600 people died as a result of the flu, and that's probably about just over 3,000 for the whole of Leicestershire. So in a period of 9 months, deaths from the flu were about a third of the number of people killed in the course of just over 4 years of the First World War. The victims of the flu pandemic have no memorials, no rolls of honour, no Remembrance Day parades or church services. Yet they were as much casualties of the First World War as the young men who died in the trenches. The phrase, "lest we forget," seems to ring hollow when we consider that so many have never been remembered. From the very outset, public health was subordinated to the needs of the war, preventative measures were not taken, and the scale of the deaths was played down. At the height of the epidemic, 358 people in Leicester died in 1 week. We've not had a disaster on that scale in Leicester, probably since the Black Death or maybe the Civil War. You would think it would be headline news, but this is how it was reported in the Leicester Daily Post on Friday the 8th of November 1918. This is page 3, and you can find the story at the bottom of the page under the report of a forthcoming visit of the royal family to Leicester. And it's very difficult to find any photographs of the pandemic which were taken in Britain. Most, like these, come from the United States or Australia, where the authorities were very active in taking precautions. In Britain, there was no planning for the pandemic, no guidance from government until the epidemic was nearly over, and what was suggested was largely ineffective. Local authorities were left to manage as best they could. The flu came to Britain in 3 distinct waves: summer 1918, autumn 1918, and the spring of 1919. Like COVID-19, there was no cure. Like COVID-19, it was transmitted by airborne droplets, and people died as the flu developed into pneumonia and bronchitis. There are several theories about the exact origin of the pandemic, and like COVID-19, it is likely it crossed over from the animal kingdom, and both birds and pigs have been suggested as a source. During April and May 1918, thousands of troops fell ill with influenza, and it's likely the virus was then brought to the Midlands either by soldiers returning on leave or by the wounded arriving at local hospitals. The epidemic came to Britain at the worst possible time. After 4 years of war, people were exhausted and hungry. There were food shortages, food queues, and OXO was even promoted as a meat substitute. The war had diverted half of Britain's doctors to the front, and those doctors not in military service were usually those over the age of 50 who lacked any up-to-date training. There was also a shortage of nurses. Many were already in France or nursing the wounded in local hospitals. This meant there was also a serious lack of capacity in local hospitals. From 1914, Leicester had become a major hub in the treatment of wounded soldiers. The Fielding Johnson building at the university, the old lunatic asylum, had become the 5th Northern General Hospital, and this had expanded and taken over the North Evington Poor Law Infirmary, now the General Hospital, and it had been renamed the North Evington War Hospital. Here, civilian patients had been moved out to other hospitals across Leicester with a loss of over 500 bed spaces. At the Royal Infirmary, wards were also filled to capacity with wounded soldiers. Initially, the medical establishment had failed to comprehend the severity of the disease, and the press did likewise. The Times suggested that the flu was ordinary flu made worse by war weariness, and talking up the dangers of the flu was seen as somehow unpatriotic. On the 24th of June, the Leicester Daily Post reported that Spanish influenza is the latest threat held over our heads by scaremongers. It is merely a coincidence of influenzic colds and the gastric troubles that have arisen from an unfamiliar diet. There was no evidence to show that it was virulent. 6 days later, the Post reported on the first influenza death in Leicester. It happened in Dorset Street, where 19-year-old Evelyn Fern, a wall spinner, lived. She complained of pains between her shoulders and back on a Thursday night and went to bed. By the following night, she was unconscious and her aunt went for a doctor, but when she got back, Evelyn was dead. Unlike COVID-19, the virus affected young people disproportionately, and by July, a very large number of children in Leicester were ill. It was estimated that 7,000 out of 57,000 children in Leicester were affected. 9 days after the first death, the council closed all schools in Leicester, and cinemas and theatres were placed out of bounds both for children under 14 and soldiers. Dr. Killick Millard, Leicester's Medical Officer of Health, was one of the first health officials in Britain to provide advice to the public. He recommended that people should resort to the parks for open-air exercise as a best means of keeping clear of the epidemic. Infection is less likely to spread if it is freely diluted with fresh air. Therefore, the more thoroughly rooms can be ventilated and flushed with fresh air, the better. And he urged people to avoid all indoor places of amusement and travel on the outside platform of trams rather than inside. Believing that dust harboured the infection, he recommended to employers that at the close of the day's work, after all the employees have left, all floors should be swept with damp sawdust. I haven't found any discussion in the press about the danger of infections being spread within factories and offices, and it would seem that more production was paramount and this issue was completely ignored. Of course, fresh air was something that was not found in Leicester's factories, or for that matter in Leicester's slums either, where you had large families living in one-up, one-down cottages and houses. But fresh air remained the treatment of choice for TB and for the casualties from the Western Front. And of course, there's a certain amount of scientific evidence for this treatment, since fresh air has been found to be a natural disinfectant. By the end of July, the summer wave of flu had seemed to have run its course, and about 100 people had died in Leicester. This was the Chris Whitty of his day. Sir Arthur Newshome was the Chief Medical Officer of the local government board, which was a forerunner of the Ministry of Health. In my view, his inaction cost thousands of lives. He'd drawn up plans to fight a second wave of influenza. This included stopping large gatherings, stopping overcrowding on public transport, but the plans were shelved. They were shelved because they would have interfered with the war effort. As a result, no instructions or guidance were given to local authorities until the 22nd of October, when the second wave of the epidemic was nearing its peak. Among the first victims of the second wave of influenza was none other than the Prime Minister, David Lloyd George. He collapsed with a fever shortly after this picture was taken on September the 11th. He spent the next 10 days immobile, with a respirator to aid his breathing. Maybe it was something like this one. His illness was hushed up for fear that the news would sap public morale. Newspapers used phrases like just a little chill to describe his condition, and his confinement was described as a precautionary measure. Despite the deaths of 100 people in Leicester during June and July, the first wave of flu had not caused Dr. Millard any serious alarm. And anyway, during August and September, the town had been nearly free of the disease. However, this was just the lull before the storm. This second wave of flu was more virulent and deadly, and it struck Leicester at the beginning of October. and in no time at all it had spread like wildfire, with whole families going down together. There were just 5 deaths in the first week of October. The following week there were 54. The week after that the death toll was over 200, and the epidemic reached its peak in the last week of October when 302 people died from flu-related illnesses. With no cure available, doctors were helpless to do anything other than try and alleviate the symptoms. With so many wounded soldiers in the town, Leicester's hospitals were simply unable to cope with the demand for beds. The Royal Infirmary was full with war casualty and was not able to take any more patients. Although beds reserved for TB and scarlet fever cases at Gruby Road and Gilrose Isolation Hospital were given over for flu victims, many sick people were frequently refused admission, and when a bed did become available, women and children got priority. There were no Nightingale hospitals, no special facilities for flu victims. Seriously ill people had no choice other than to stay in their homes. But the acute shortage of nurses meant that home care was not provided even when several members of a household were ill simultaneously. Dr. Millard reported that on more than one occasion people were found dead in their homes, with others dangerously ill. The lack of hospital accommodation was a serious problem, made worse as doctors and nurses went down with the flu. At one time, 28 members of the nursing staff at the Poor Law Infirmary were off sick. Faced with the enormity of the situation, the Council's Sanitary Committee did its best by appealing for anyone with nursing experience to come forward and help. It underlined the seriousness of the situation by publicising several cases. The Post reported that in the Willow Street district there was a mother and 3 children, all ill with no one to look after them. There was another case where the husband was delirious and his wife and a female lodger both ill. The only other person in the house was a 16-year-old daughter. In the Elston Road district, a mother and her 2 children were ill whilst her husband was dying. Only the grandmother was there to look after them. In the Wolf Street area, it was reported that a husband and wife both had very bad cases of pneumonia. There were 2 little children in the house with flu, but no one to look after them. In Leicester, doctors were run off their feet, and Dr. Millard directed all the medical staff employed by the council to help out local doctors. One doctor devised a system to deal with the situation. He summoned all the 25 patients he had in one street and wrote just one prescription, telling them to pass it along to their neighbours. 2 gentlemen placed motor cars and a chauffeur at the disposal of the Sanitary Committee, and ambulances were forthcoming from the Fire Brigade and the Red Cross. Boy Scouts also helped Dr. Millard as messengers. Undertakers in the town had laid down a rule rationing only 1 hearse and 1 coach for each funeral, but even then they were finding it difficult to cope with the demand, and there was a long waiting list for funerals. The funeral corteges followed each other through the town, and often there was more than 1 cough into a hearse. One correspondent noted that on the 2nd of November he had seen 3 funerals pass in the space of a half-mile walk. Such was the pressure on undertakers that the hearses were being drawn by trotting horses rather than being taken at the usual slow and stately pace. The son of one local Baptist minister wrote that his father slept in the cemetery chapel whilst he conducted funerals from dawn until dusk. Extra staff had to be drafted in to dig graves at the cemeteries, and frequently more than 1 person was buried in the same grave. This was often the case when victims came from the same household. There was a shortage of coffins too, and the extra demand was met by the railway workshops and the workshops at the tramways. The press reported that all public services were affected. All the schools in the town were closed, and the sickness of 70 of the tramway staff meant that public transport was also affected. There's no mention in the press of the Leicester Police, but practically every constable in the Lutterworth division was laid up with influenza. Despite all this dislocation and tragedy, Leicester's factories did not stop working. However, sickness meant that during the worst days they operated at a reduced level. On the 22nd of October, the local government board did eventually issue some guidance, which was that under present circumstances, every patient who has a severe cold or fever should go to bed and stay there for 3 or 4 days. This advice was embodied in what was probably the first public information film. It tells the story of what happened when a Mr. Brown, who does not stay in bed, goes around London spreading infection. I think it was made around November 1918 and released in 1919, but apparently it did not have a very wide circulation. At the end of October, at the height of the epidemic, the council called a conference to see if Leicester's places of resort, that's the churches, cinemas and pubs, see if they could be closed to halt the spread of the infection. With 283 deaths the previous week, the Mayor, Sir Jonathan North, said the situation warranted some exceptional measures. It was thought that an appeal should be made to close all places where people congregated. Large posters would be put up all round the town urging people to keep away. It was thought that churches and chapels should also be closed, and if possible, pubs too. Dr. Millard said that there was no doubt that the disease was spread where people were crowded together. They'd like to close the factories too, but they could not suspend the industries of the town. Despite the gravity of the situation, there was combined opposition to any attempt at closures. The Reverend Elliot, the rural dean, claimed that there was no authority short of a royal proclamation that could order churches to be closed. To close the churches at a time when people were in very great sorrow and bereavement, and to deny them the opportunity of public prayer would be a profoundly irreligious step. In any case, there were very few instances of crowded congregations. The cinema owners thought that they were doing a useful service by taking people's minds away from the seriousness of the situation, and the publicans cited the sheer impossibility of preventing overcrowding. A compromise was struck whereby both the theatres and cinemas were to have intermissions to enable proper ventilation to take place between performances. Placards were produced in Reading and they were posted round the town warning people to avoid crowded rooms or halls and to take every advantage of the fresh air. However, on the following Monday, at the height of the epidemic, the press reported that there were crowded houses at the Leicester Palace Theatre. And of course, even though it was the final week of the war, the factories kept on working. It's natural that many people look to their doctor to provide them with a cure, But there was no vaccine and the doctors had no effective treatment to offer. As a result, there was a lot of confusion within the medical profession as doctors clutched at any straw which might provide an answer. One of the favoured methods by the Medical Officer of Health in Leicestershire, Dr. Farrer, he recommended the use of bed rest, nasal douches and gargling. And gargling was much favoured by the local government board, who shows you how to do it in their little film. However, most doctors commonly prescribed alcohol, usually whiskey or brandy. The problem with this was that owing to the war, alcohol was in short supply. And as the epidemic became more serious, there were calls for larger supplies of whiskey and brandy to be released to treat the sick. There was a proliferation of quack remedies, and adverts for a large range of patent medicines and other preparations appeared in the local press. A number of companies like Bovril and Oxo traded on the fear of illness to sell their products. This is the town hall on the 11th of November 1918. We can see the mayor, Walter Lovell, announcing the end of the war to a crowd of thousands. People filled the streets and there were celebrations on a grand scale. Church bells rang, bands played, there were torchlight parades, bonfires, church services and a huge public celebration on Victoria Park. In the week before, 219 people had died from the flu, and no thought seems to have been given to the dangers of such large gatherings. The epidemic was subsiding, but it's entirely possible that the spike of deaths we see later in the month were the consequence of these armistice celebrations. This was certainly the case in Nottingham and other cities. One of those who died at the tail end of this wave of the flu was 36-year-old nurse Kathleen Adele Brennan. She was an Australian volunteer and was working at the North Evington Military Hospital. She died on the 24th of November and was buried with full military honours at the Welford Road Cemetery. This is a cortege on London Road, probably opposite the Old Horse, and it's the only photograph I've found of a funeral of a flu victim. Christmas 1918 was more sombre than festive in Leicester, and the Mercury reported that on Christmas Day, the Welford Road Cemetery provided a scene of remarkable, if pathetic, interest. It was something in the nature of a sacred pilgrimage for many hundreds of people. It would scarcely be an exaggeration to say thousands, who desired on this day to pay tribute and honour to their beloved dead. By the afternoon there was scarcely a grave which did not bear some tribute of affection, a cross of evergreen or a wreath of flowers. In the part of the cemetery where there were new graves of flu victims, the Mercury reported that with no headstones to impede the view, the ground here appeared from a short distance away to be one mass of flowers. The third and final wave of influenza started quite suddenly in February 1919. It began at the military hospital where some recently admitted soldiers died, and the infection spread to the town, and in the first week of March, 51 people died. Again, the sanitary committee ordered that all places of amusement must have an interval of 30 minutes every 4 hours to ventilate the building. Appeals were made again for nurses, especially for anybody willing to sit up at night with sick people. Posters were put up warning the public against crowded meetings. But despite the fact that the war effort was now over, work in the factories carried on unimpeded. It was said at the time that this third wave was relatively mild in comparison with what had happened in the autumn. Nevertheless, in Leicester, between the 22nd of February and the 22nd of March, there were 261 people who died from this wave of the flu. Leicester, along with Nottingham, was amongst the most severely affected towns in England and Wales. Whilst the elderly and the very young were not immune, it was a high number of deaths of young people in the prime of life that was so unexpected and so difficult to comprehend. In the aftermath of the pandemic, much was made of the fact that wealth had little impact on who caught it. It was true that notable citizens like Mrs. Cynthia Fielding Johnson and Norma Land, the wife of the Bishop of Leicester, were among those who died. Though wealth did not confer protection, it was those on the bottom rungs of the social ladder that suffered most. The poor areas of Leicester, which had already had high death rates from TB and other diseases, also had a higher mortality from Spanish flu. The only way to have prevented a greater loss of life was to have imposed strict individual isolation on those affected. The death toll in Leicester would not have been so high if it had followed the examples of many US cities. Although there was a large loss of life in the USA, many states were active in taking precautions which had some success in flattening the curve. The lack of proper quarantine measures and of social distancing, the lack of hospital beds and of proper nursing care were all key factors in the high number of deaths in Leicester. Despite having a well-respected medical officer of health, like all Britain's public health advisors, he was willing to tailor his advice to suit the political needs of the day, and this of course was reinforced by a censored press. Lloyd George's government has never been held to account for its negligent approach to the epidemic. It is only now, in the midst of our present pandemic, that we can see its failings.